Ziac is a combination medication used to treat high blood pressure. It contains two medications, bisoprolol and hydrochlorothiazide. Bisoprolol is a beta blocker that slows the heart rate, lowers blood pressure, and reduces strain on the heart. Hydrochlorothiazide is a diuretic that increases urine production, helping the body get rid of extra salt and water, which can relax the blood vessels and improve blood flow. This combination is used when one medication alone is not controlling blood pressure. It can also reduce the amount of each drug needed, lowering the risk of side effects. It is usually taken once a day, and it is important to take it at the same time each day for the best results. When taking Ziac, it is important to follow your doctor's instructions. Typically, it is taken once daily, with or without food, and the dosage will depend on your medical condition and how you respond to the treatment. To avoid having to get up to urinate during the night, it's best to avoid taking Ziac within 4 hours of bedtime. If you have any questions about when to take it, consult your doctor or pharmacist. If you are also taking cholestyramine or cholestyramine, make sure to take Ziac at least 4 hours before or 4 to 6 hours after taking those medications. It's important to take Ziac regularly to get the most benefit from it. Try to take it at the same time each day to help you remember. Even if you start feeling well, continue taking it as prescribed. It may take up to 3 weeks before you start to see the full benefit of this medication. If your condition worsens, such as an increase in your routine blood pressure readings, inform your doctor. As your body gets used to Ziac, you may experience dizziness, lightheadedness, tiredness, and drowsiness. You may also feel nauseous, have an upset stomach, diarrhea, cough, constipation, or trouble sleeping. If any of these effects last or get worse, notify your doctor or pharmacist right away. To lower your risk of dizziness and lightheadedness, make sure to get up slowly when rising from a sitting or lying position. Ziac may also reduce blood flow to your hands and feet, making them feel cold. Smoking can worsen this effect, so it's best to dress warmly and avoid tobacco use. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. However, the hydrochlorothiazide in Ziac may cause dehydration and electrolyte imbalance. If you experience symptoms of dehydration such as very dry mouth, extreme thirst, muscle cramps/weakness, fast heartbeat, fainting, or seizures, it's important to tell your doctor right away. Additionally, you should contact your doctor immediately if you experience serious side effects such as very slow/irregular heartbeat, swelling of the ankles/feet, shortness of breath, sudden/unexplained weight gain, loss of feeling/tingling in the fingers/toes, hair loss, decrease in vision, eye pain, mental/mood changes, shaking, decreased sexual ability/interest, muscle/joint pain, signs of liver disease, easy bruising/bleeding, signs of infection, or signs of kidney problems. While a serious allergic reaction to Ziac is rare, seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed above. If you have chest pain or heart disease, do not stop using Ziac without consulting your doctor. Your condition may become worse if the drug is suddenly stopped. If your doctor decides you should no longer use Ziac, you must gradually decrease your dose according to your doctor's instructions. When gradually stopping Ziac, it is recommended that you temporarily limit physical activity to decrease strain on the heart. Get medical help right away if you develop worsening chest pain, tightness or pressure in the chest pain spreading to the jaw/neck/arm, sweating, trouble breathing, or fast/irregular heartbeat. Before taking Ziac, make sure to inform your doctor or pharmacist about any allergies you may have to bisoprolol, hydrochlorothiazide, beta blockers, or thiazide diuretics. Also, discuss your medical history, including kidney disease, liver disease, heart rhythm problems, heart failure, lung disease, thyroid issues, diabetes, gout, salt imbalance, dehydration, circulation problems, muscle diseases, lupus, recent nerve surgery, and skin cancer. It's important to talk to your doctor or dentist about any medications or herbal products you are using before undergoing surgery. Be cautious of activities that require alertness, especially when using alcohol or marijuana with Ziac. Also, drink plenty of fluids to prevent dizziness and avoid heavy exercise and hot weather. If you have diabetes, monitor your blood sugar levels regularly, as this medication may affect it. And, talk to your doctor about adding potassium to your diet, as this medication may reduce potassium levels in your blood. Finally, be aware that Ziac may make you more sensitive to the sun and increase your risk for skin cancer. So, limit your time in the sun, wear protective clothing, and use sunscreen. And, if you are pregnant or breastfeeding, consult your doctor before using this medication. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Ziac include alpha blockers, diazoxide, digoxin, dofetilide, drugs that affect heart rhythm, epinephrine, phenoldipam, fingolimod, lithium, other drugs for high blood pressure, probenecid, and St. John's wort. Additionally, some products have ingredients that could raise your blood pressure. It's important to inform your pharmacist about the products you are using and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen/naproxen. Furthermore, Ziac may interfere with certain lab tests, potentially causing false results. It's important to ensure that lab personnel and all your doctors are aware that you are taking this medication. If someone has taken too much Ziac and shows serious symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the US, you can call the Poison Control Center at 1-800-222-1222, while in Canada, you can contact a provincial poison control center. Symptoms of an overdose may include a very slow heartbeat, severe dizziness, fainting, severe weakness, and trouble breathing. It's important not to share this medication with others. Make sure to talk with your doctor about lifestyle changes that can help this medication work better, like stress reduction, exercise, and dietary changes. You may need to have lab or medical tests done while taking this medication, such as checking electrolyte levels, liver function, and blood counts. Be sure to keep all your medical and lab appointments and consult your doctor for more details. Also, make sure to have your blood pressure checked regularly while taking this medication. You can learn how to monitor your own blood pressure at home and share the results with your doctor. If you forget to take a dose of Ziac, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take a double dose to make up for the missed one. Make sure to store Ziac at room temperature, away from light and moisture. It's important not to store it in the bathroom, and always keep it out of reach of children and pets. When it comes to getting rid of any unused or expired Ziac, don't flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, consult your pharmacist or local waste disposal company for the proper way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.